Hi all, and thank you for tuning into Lab Red Owl. So lately I've been receiving a lot of questions from you guys, which I really love. It really gives me feedback on how I need to go on with this sort of thing. But most of them resolve about smallpox, so I'm hoping to help you today. Smallpox is from a strand of disease called the variola virus. Has two strands, cowpox and smallpox. It is commonly known that cowpox, when someone contracts it, they are then immune to smallpox. Smallpox is transmitted through all the bodily fluids of an infected person, and is highly dangerous as it can also linger in the air where they've been. It can cause painful rashes, boils, chills, fever, vomiting, headaches, back, abdominal, and a sore throat. As if these symptoms weren't bad enough, most cases of smallpox either cause death or severe scarring. Even Pharaoh of Egypt, Ramses V, exhibited smallpox scars on his mummified body. The host demonstrates the symptoms of smallpox after a day or two, which is pretty good in comparison to other diseases like measles, which can take up to a week. Smallpox has the amazing ability to bypass the immune system of the host, which is truly incredible considering that most diseases cannot make it past the second line and the third line of defense. Smallpox is now an ancient memory of how the world used to be. Smallpox was one of the most deadly diseases in the world. Edward Jenner invented the smallpox vaccine. He was the first to come up with the idea of inoculating cowpox into the immune system to prevent smallpox, although he was not the first to come up with inoculation. It had been used for years by the Chinese. They would purposely crush up a smallpox royals and inhale them to give themselves the disease in the hopes they would become immune. Although this was a highly dangerous method as they would never be sure that the disease was actually dead. It could have been very much alive, and many results of death happened. Yeah. One day, inoculated an 8-year-old boy, James Phillips, with cowpox from Sarah Nelson's hand. James suffered with cowpox, but he then recovered. And then he was inoculated with smallpox, and he proved immune. Jenner's theory had actual proof in this 8-year-old boy, James. The World Health Organization affected vaccination in a very specific way. Once someone was infected with smallpox, the authorities would then vaccinate everyone who'd been in close contact with the infected. And this continued until May the 8th, when the World Health Assembly declared the smallpox had been eradicated. Although eradication is not the correct term, as two controlled smallpox viruses remain in two labs, one in Russia and one in the USA. The USA government complained that they had the specimens so that if smallpox is ever used in biochemical warfare, once again, the faster cure could be made. 1 million people who receive the smallpox vaccination will die. 300 people would develop painful rashes and sores, and 600 others would have potentially fatal brain damage. In 1967, WHO began the campaign to end smallpox. At that time, 2 to 3 million people each year died from smallpox, and this is why the World Health Organization recommended that people were vaccinated. During the 18th century Europe, the percentage of people that contracted smallpox and died went from 20 to 60%, which was nothing compared to the rate in London, which was 80%, and reaching 98% in Berlin at the end of the 1800s. To truly evaluate the effectiveness of the smallpox vaccine, it should be compared to other programs which are currently in use. We'll be looking at polio and Diptheria's vaccination programs. The polio vaccination. Children are recommended the immunization program as a dose of 3 courses. So it's during the ages of 2, 4, and 6 months of age. The first dose of vaccination can be administered as young as 6 weeks old. Children are injected with a booster vaccination at 4 years of old, and again they can have one from 10 years old on. The oral vaccination is no longer in use as it did contain small amounts of live virus, which could end up with someone actually contracting polio and getting severely sick. That's why it's no longer used in Australia. People who have been administered with the oral vaccination need to have a needle later just to make sure that they're truly alright. The needle is highly effective in producing immunity to the polio virus and protecting vaccine receivers from polio paralysis. After 2 doses of the polio vaccine, over 90% of recipients develop protective antibodies from the polio virus. After just 3 doses of the vaccine, 99% of recipients have immunity to this devastating virus. The polio vaccination can induce edema and pain to the injection site. Other symptoms occur in babies upon receiving the vaccination, such as decreased appetite, fever, crying. And for special risk groups, a booster dose is recommended every 10 years, such as travelers, healthcare workers, people who have any contact with people suffering with polio, and of course, polio laboratory workers. Inactivated polio vaccines are safely administered to those who with impaired immunity and those living with someone with an impaired immunity. Diptheria. For children, there is a recommended 5 doses for the tetanus and cellular pertussis vaccine. The DTaP should be administered at 2, 4, 6 months, and 15 through to 18 months, 4 through to 6 years old. The DTaP vaccine cannot be administered to anyone over the age of 6, although a similar vaccine can be administered to adolescents and adults called the TD or the TDAP. The TD is a tetanus diphtheria vaccine given to teenagers and adults every 10 years as a booster shot. Adolescents in the age group of 11 to 18 years old should receive a single dose of TDAP. Pregnant women should receive a dose of the vaccine from the pregnancy around 27 to 36 weeks on, and they should receive a vaccination after giving birth to the baby. In these acronyms, the capitals stand for larger amounts of chemicals in the vaccination. Both of these vaccinations have managed to prevent and control the number of affected people in the western area of the world, although in some less fortunate countries, these diseases run wildly. And though there are some WHO initiatives trying to reach those countries in the attempt to fully eradicate these diseases, overall the effectiveness of these vaccines are incredible. Especially the smallpox vaccine, which has fully eradicated the threat of smallpox. Although a percentage of people who receive the smallpox will die, the benefits of having the vaccination outweighs the negatives, whereas other vaccinations have less risk of danger, so full country vaccinations are becoming more common. I really hope this helps your understanding, especially you hipster high dolls. Labrat L, signing off.